Discussion is surface contour of bones. Basically this topic is that those structure which are present on the bones, it may be articulate, it may be not articulate, and which help to the blood supply, and other structure which are present on that bones, it is called surface contours of the bones. So here is that we discuss about one by one things which are present on the bones. First thing is that acetabulum. What is that acetabulum? Acetabulum is a deep articular cavity. This one is that present on the OS Coxae bones or hip bones. This one is that acetabulum. And other terms which are parallel to that acetabulum, it is called glenite cavity. Glenite cavity, this one is the large, smooth and shallow cavity. This one is that glenite cavity, large, shallow and smooth cavity. This one is that acetabulum and this one is that glenite cavity. Third thing is that here is the fovea. Glenite cavity and acetabulum is the articular, but in case of the fovea, this one is the small depression but non-articular. This one is that this one is only on the present on the femur head. And third thing is that facets. Facet is the term which are used for the small articular surfaces which are present on the flat or concave surfaces. This one is that facets. Here is the number is pointed here. All of these are facets, which may be small, may be large, and may be concave or convex. This is called facets. And next term is that crust. Crust, this one is the linear sharp ridge. This one is the linear sharp ridge which are present in most of the bones. This one, it is called crust. And second term is parallel use line. This one is that very faint ridge, look like this. Very faint ridges present on the bones. This is called lines. And next term is that foramen. A natural opening or perforation in the bones, it is called foramens. Natural opening or perforation. They look like the holes. And here the blood supply, it will be provided through these foramens. And two things, second term, it's the most important, look like the foramen. कोई से भी दो एक जो होल है जिसमें से दोनों तरफ से आप देख सकते हो, पास कर सकते हो. दिस वन इट इज़ कॉल्ड कैनाल. वर्टिब्रल कैनाल आप लोग जब हम लोगों ने सरफेस आपको मैंने टाइप्स ऑफ बोन में वर्टिब्रल कॉलम देखा है तो वहाँ पे आपको पता है एक लंबी आपको कैनाल नज़र आ रही है. और यहाँ पे आप देखें कि ये आपको जो है वो कैनाल नज़र आ रही है जिसके एंटीरियर और पोस्टीरियर दोनों साइड पे ओपनिंग होगी. ठीक है, दिस वन इज़ दैट canal. And second term is that condyles. This one is the condyles. What is the condyles? Smooth, convex. This one is the smooth, convex, articular, large cylindrical mass situated on the distal end of the bones. Large, smooth, articular ridge which is present on the distal end of the bone, this is called condyles. And second, that condyles further have two types. First thing is that a term is used trochlea and second term is that used cochlea. Trochlea just look like the pulley like structure. This one is also a category of the condyles, but this one is the pulley-like structures, and it have two ridges, and in the midway have a depression. Its reciprocal term is called cochlea. Its center have a ridge, single ridge, and periphery located the depression. This term it is called cochlea, and this one it is called trochlea. And three things we will discuss here. First thing is that condyles, and trochlea and cochlea is also a further types of the condyles. And in the center of the depression is present, this one it is called trochlea, and in the center have a ridge present, this one it is called cochlea. And first thing is smaller condyles, it is called epicondyles. This one is the rough enlarged part which is proximal to the condyles. This is called epicondyles. Second, next time we use here, this one is the head. It is present most commonly term is used head, rough, strongly convex, articular projecting mass, situated at the proximal end of the long bones. This one is the head. It is present on the femur, humerus. This one is also a head. And main mass, main body and head which are articulated through the projection, this is called neck. This area it is called neck, just like below the neck. This one is that, this is head, this one is that neck, this one is the body of the bones. Head, neck and body of the large bones. And second term is that processes. General term used for the prominence, it is called processes. First thing is that spine. It is an thin, elongated, prominent projection. Thin भी है and elongated, prominent projection. It is called spine. And second term is that first three terms are used for the projection: tuberosity, tubercle and trochanter. First we will discuss about the tubercles. Small non-articular projections present on the bone. This is called tubercles. This one it is called tubercle. It is present in the lots of the places in the bone. This one is also a tubercle, and here this one is also a tubercle. It is present in the lots of the bones. And second parallel term is used, tuberosity. This one is the relatively large non-articular projection. This is called tuberosity. And first term is parallel use in case of the femurs, replacement of the tuberosity. This is called trochanter. This term only used in the femur bone. This one is also a large non-articular projection, but in case of the femur it is called trochanter. This is all about the, and first term is the sinuses, which is present in the large cavity of the bones, which is called sinuses.